Breaking a bone, well, it's a pretty jarring experience, right? But getting a handle on what's actually happening inside your body is a huge first step toward a strong, confident recovery. So in this explainer, we're going to walk through that entire journey, from the second it happens to the moment you're back on your feet. So here's our game plan. First, we'll nail down what a fracture actually is. Then, and this is super important, we'll cover the warning signs that you just can't ignore. After that, we'll look at how doctors actually fix a break, map out what that road to recovery looks like, and then we'll wrap up by tackling some of your most common questions. All right, let's start at the very beginning. What is actually going on in your body when a bone breaks? Let's get into the basics. So let's just get right to it. What are we even talking about when we say the word fracture? In the simplest terms, a fracture is just a break in a bone, but it's not really just one thing. It's more like a whole spectrum. On one end, you could have a tiny hairline crack, something so small it's barely visible. But on the other end, you could have a complete break where the bone is in two or more pieces and totally out of place. And this table does a great job of breaking down the three main types. First, you've got a simple fracture. That's a clean break where the bone stays put, right under the skin. Now, a compound fracture is a whole different level of serious. This is where the broken bone actually pokes through the skin, which opens the door for infection. And finally, you have a comminuted fracture. That's when the bone shatters into a bunch of pieces. It's like a jigsaw puzzle that surgeons have to carefully put back together. Okay, so knowing the types is one thing, but knowing when you need to get help, and fast, is absolutely critical. That brings us to our next section, the warning signs you really can't afford to ignore. I want you to think of this as your absolute must-act checklist. Any of these things, that sudden, really sharp pain, a limb that just looks wrong, or especially if you can see the bone, that's your body screaming for immediate medical help. Don't wait. Waiting can just make things way more complicated down the line. So you've done the right thing. You've gone to the doctor. What happens now? Let's pull back the curtain and take a look at the treatment journey and see how doctors actually get that fracture fixed. The whole process follows a pretty logical path. First up is stabilization. That's putting on a cast or a splint to keep anything from moving around and causing more damage. Next, there's realignment, or what doctors call reduction. This is where they carefully put the broken pieces back into their proper place, kind of like reassembling a puzzle. And finally, for the more complex breaks, you have fixation. That's surgery, where they might use plates and screws to lock everything together so it can heal perfectly. And when we talk about fixation, there are basically two ways to go about it. With internal fixation, all that hardware, the plates, the screws, goes inside your body, right on the bone. But with external fixation, they build a rigid frame on the outside of your body, and it uses pins that go through the skin to hold the bone in place. Which one they choose really just depends on the specific injury. Okay, so the bone is stabilized, the surgery is done, but that's really just the beginning. Now comes the most important part of this whole journey, the road to recovery. So what's the timeline we're looking at? Well, for most major fractures, you can expect the basic bone healing to take somewhere in the neighborhood of 6 to 12 weeks. Now, that's a big range, and for good reason. A broken finger is going to heal a lot faster than, say, a broken femur. Plus, your age and your overall health play a huge role, too. And this right here is the key takeaway. It's such a powerful message. With the right medical care and your own hard work, a full recovery isn't just some vague hope. It's what everyone is aiming for. It's the expected outcome. And this is so crucial. Recovery doesn't end when the cast comes off. Not even close. I mean, think about it. Your muscles have been locked in place for weeks, so they've gotten weaker. That is where physiotherapy becomes your best friend. It's not just about doing a few exercises, it's a dedicated plan to rebuild that lost strength and get your mobility back. All right, let's wrap this up with a little rapid-fire round. In our final section, we are going to answer some of the top questions people have when it comes to recovering from a fracture. First up, a question we just touched on, but it is so important it's worth asking again. Is rehab really necessary after every single fracture? The answer is a huge, definite yes. It's not really optional if you want the best possible outcome. Think of it like this. Without PT, you're risking long-term problems like stiffness or weakness. With it, you're investing in a full, durable recovery. Here is another big concern people have, especially after a really serious accident. Can surgery actually get you back to 100%? And the answer in the vast majority of cases is yes. It's amazing what modern surgery and dedicated rehab can accomplish when they work together. For most people, getting back to normal, or at least very close to normal, is an absolutely realistic goal. And that brings us to our final question. What's the single most important factor in your recovery? Well, after everything we've talked about, the answer really is the partnership between you and your medical team. The surgeon's incredible skills sets the bone, but it's your commitment to the recovery plan that really seals the deal. That's the key.